Hello everyone, I'm Dr. Charulata Sankla. I'm a neurophysician in Hinduja Hospital and I have special interest in the patients with Parkinson's disease. So I'm going to tell you a little bit about Parkinson's disease in my presentation. What is Parkinson's disease? This is a brain disorder that causes a gradual loss of muscle control. The symptoms of Parkinson's can be very mild initially and many a times they go unnoticed by the patients and their relatives. The typical signs and symptoms include tremors, that is shaking of the hands, stiffness of the body, slowed body movements and poor balance. Parkinson's were originally called a shaking palsy, but not everyone with Parkinson's disease have tremors. In 1817, we know about this disease when James Parkinson was the person who actually observed the patients walking on the road on the streets of England, and he described it as an involuntary tremulous motion with lessened muscular power, in part not in action and even when supported, with a propensity to bend the trunk forward and to pass from a walking to a running pace, the sense and intellect being uninjured. And this description still holds true. While Parkinson's can be a very frightening diagnosis when told to you initially, life expectancy does not change, particularly with better care and prompt treatment. The symptoms of Parkinson's disease progress slowly over 10 to 20 years. Early treatment, early recognition of the symptoms can allow the patient to live a normal life, maintain their jobs. We see a lot of younger patients with Parkinson's disease in India as compared to the West. In India, this is a disease of middle-aged to young patients as well. The two advocates which are seen in this picture are the boxer Muhammad Ali, who was affected with this disease at the age of 42, and Hollywood actor Michael J. Fox at the age of 30. And there are many eminent personalities who were affected by this disease, namely the late John Poe. The early signs of disease can be confused with a lot of other conditions, and they're very subtle. The patients initially notice mild shaking of the finger, hands, legs or lip. They may complain of frozen, restricted shoulder movements. They may have stiffness or difficulty in walking. They have difficulty in getting out of the chair, particularly a low-lying sofa sits. They tend to have a small, crowded handwriting, and very often patients complain that the banks have noticed a change in their signature. The patient occasionally has stoop posture. The face lacks expression, and hence it's called a mask-like face. One of the symptoms of Parkinson's is tremor, but it's not seen in all the Parkinson's patients. It's only seen in about 70% of the patients. It usually occurs in the fingers or a hand when the hand is at rest, particularly when the patient is walking or when the patient is doing some activity such as watching TV. But these tremors are not present when the hand is in use. The hands and fingers shake as if there's a pill between the thumb and the index finger and you are rolling them. These are the movements of the tremors in the Parkinson's disease. The next symptom of the Parkinson's disease is called bradykinesia. Brady means slow, kinesia is movement. That means it's a slow movement. We all know as we grow older, we tend to slow down. Bradykinesia in Parkinson's patient means slow movement which impairs their daily activity. They take slightly more time to do the same activities which they could do much faster earlier, particularly dressing up, taking bath, or eating. They tend to do this very slowly. The Parkinson's patient tend to take very small steps while walking. The stride length reduces over the period of time. They sometimes suddenly stop, particularly near the doors, and they're unable to navigate themselves through the doors. And this is seen in the crowded places as well. Their body somehow does not respond to the commands that are going on in their brain. The Parkinson's patient also blink less and have mask-like face. They have a softer voice, low volume speech, and their speech can be slurred occasionally. They also have difficulty in balancing themselves, particularly when they turn. They are unable to turn swiftly as we all can. They tend to develop stoop posture with drooped shoulders and their head is jutted forward, and they may have problem with the balance. This causes increased risk of the falling, and they tend to run in the small steps forward while walking. They also have rigidity, which means their muscles are stiff. They don't relax easily. It's difficult for the patients with Parkinson's disease to move their arms and legs. And when you move their arms and legs passively, there is some resistance. Because of this rigidity, the arms may not swing when the patient is walking. They may also experience cramping and pain in the muscles. In addition to all the motor symptoms that are described earlier, we also see some of the symptoms which are non-motor, such as night terrors, restless sleep. The spouse of the patient very often comes that the patient wakes up in the middle of the night with screams and they've seen some bad dreams. The patients also feel unusual fatigue. Constipation can be very severe and may be seen very early in the disease and sometimes preceding the motor symptoms as well. The patient have increased tendency to pass urine, particularly in the night, and they have to get up number of times to pass urine. They have difficulty in swallowing, they tend to choke at times. They may have memory problems, particularly the patients, elderly patients of Parkinson's disease. There may be some confusion, particularly in the late evening. Or they may progress to overt dementia where they tend to forget things, they are unable to take care of themselves. Parkinson's patients also have oily skin and dandruff and they lose the sense of smell as well. There are many questions that the patients often ask me in my OPD. Can I get PD? Everyone doesn't get PD. Usually we know that the average age of onset is 55 and old age increases the risk of getting PD. So as we grow older, we tend to lose the cells and that makes us more prone to developing PD. Having a family member with PD poses a very slight increased risk and men are more likely to get Parkinson's disease as compared to women. So what happens in the brain when you get Parkinson's disease? There's a small area in a structure called brainstem which is called substantia nigra. Now this tiny area produces a chemical called dopamine. Dopamine is an amino acid and it's very essential in the brain to control the movements, particularly the planning of the movement and the speed of the movement. And in Parkinson's disease, these dopamine producing cells die and this causes misplanning and altered speed of the movements. Also there is difficulty in initiating movements. And there are various ways to find out how many cells have died and how much DOPA deficiency there is in Parkinson's disease patients. We do a study called DAT scan where we tag the radionuclear marker to the cells in Parkinson's disease and we know exactly how much DOPA deficiency has occurred in the Parkinson's patient's brain. And this scan helps us detect early Parkinson's disease as well as to diagnose it from the other causes of the Parkinson's disease such as drugs and toxins. How do we treat Parkinson's disease? We need multidisciplinary approach. It's not just taking the pills. So we have medicines which definitely help the signs and symptoms of Parkinson's disease. We also offer certain patients of Parkinson's disease surgical treatment. Physiotherapy is very essential in the treatment of Parkinson's disease. Occupational therapy is required to modify the home so that they can make the changes in the home to make the home comfortable for the patients. We have Parkinson's disease support groups all over the Bombay and in some places in India to increase the awareness of this disease. The patients tend to talk very softly, so they also require speech therapy to help them speak better and communicate better. There are many drugs in PD. They are broadly divided into these 6 categories. The main drug which is very important is levodopa. Then the second group of drug is dopamine receptor agonist. Third group is MAO-B inhibitors and COMT inhibitors, anticholinergics and amantadine. We also offer surgery to the Parkinson's disease. Electrodes are implanted in one of the areas of the brain, usually in the subthalamic nucleus and rarely in globus pallidus and thalamus. And then a pulse generator is placed in the chest to stimulate these particular areas. And when we stimulate these areas in the brain, it reduces the symptoms of Parkinson's disease, particularly rigidity, tremors and bradykinesia. However, surgery doesn't stop the progression of the Parkinson's disease or affect any other symptoms. And not everyone is a good candidate for this surgery. A selection of proper patient is essential for good outcome post-operatively. And here you can see in this picture, the electrodes are placed deep into the brain. The electrode wire is then transferred to the chest subcutaneously, and you can see Dr. Milind Sankhe operating a Parkinson's patient in Hinduja Hospital. This is an awake surgery. You can see us holding his hand, the patient is fully awake, and when we place the electrode, we can actually see that the patient's symptoms improved on the operating table itself. So we know that the electrode is placed properly in the brain. Many patients ask me, can we prevent PD? We've been trying to find the answer to this. Various researchers have been trying to prevent PD or halt the progression of the disease. But it's too soon to tell whether all the therapies that we are looking at will work eventually. We all know that well-water drinking in early age have been found to increase the chances of developing the disease. Surprisingly, coffee drinkers and smokers have lower risk of developing the Parkinson's disease. But smoking may obviously have other serious health consequences, hence we don't advocate to start smoking in the Parkinson's patient. We also know that environmental toxin, in addition to the genetic factors, play a role in development of this disease. Exposure to pesticides, herbicides, particularly which are mixed in the well water, we know now increases the risk of the PD. However, there has to be a genetic susceptibility to environmental exposure. Not everyone who is exposed to the environmental toxin will get PD. We know that the workers who are exposed to the manganese in the mines in India develop Parkinsonian features. So there is some role of the environmental toxin, and we see this disease more in the developed countries than the developing countries. How do we combat Parkinson's? We advocate all the Parkinson's patients to be active, and they should actively exercise because it has protective effect by enabling the brain to use the dopamine more effectively. It also helps improve motor coordination, balance, gait, and tremor. Exercise releases the nerve growth factor, which may play a key role in Parkinson's disease brains. Working out on a treadmill and biking have been shown to have a benefit. Tai Chi and yoga may help the balance and flexibility. And here in this picture, you can actually see a Parkinson's patient undergoing Iyengar yoga therapy, and we realized at the end of this yoga therapy their cognition, their mood, and their feeling of well-being in addition to their motor symptoms has improved significantly. So Parkinson's disease affects many aspects of the daily life, but with medication, supportive therapy, patient can remain active. Medications can help patient cope with the mood disorders such as depression and anxiety. Occupational therapists can provide a home safety evaluation such as removal of the fall hazards, throw rugs, cords, add grab bars in the bathroom, elevate the seats of the bath so that patient can get out of the toilet seat easily. A speech therapist can help with swallowing as well as the speech problems. Caregivers of the Parkinson's patient are most important. In addition to losing motor skills, PD patients are emotionally very low. Depression often precedes the motor slowness. To do daily tasks are marathon efforts for the PD patients such as taking bath, eating, and they should be constantly encouraged to do these simple tasks independently. Caregivers need to understand this and provide necessary support to keep the patient active and independent. We have various support groups and online forums which help you deal with these situations. Thank you. I'm Dr. Charulata Sankla. I'm available every day in Hinduja Hospital. My OPD timings are between 1 to 4 from Monday to Friday, with an exception on Wednesday when I sit from 4:30 to 6:30. Can Parkinson's be cured completely? Parkinson's disease, Tony, is like diabetes. So we need to control it. Diabetes, if you control the sugar, we can prevent the complications of diabetes. It's the same in Parkinson's. If we treat it effectively in time, then we can control the Parkinson's disease and we can help patient live almost a normal life. The second question is by Jitendra. My hand and leg movements are slow, impaired balance. Please suggest treatment. I think you need to see a neurologist who can examine you, decide at what stage of Parkinson's disease you are in if you have Parkinson's disease, and then decide on the treatment. The treatment is catered to an individual patient and it cannot be generalized. So you need to see your neurologist. My MRI and DSA is okay. MRI is not required to diagnose Parkinson's disease, nor is digital subtraction angiography required. It's a clinical, your clinical symptoms tell us whether you have Parkinson's disease or not. How to check Parkinson's disease? Parkinson's disease, as I told you all the symptoms, you can look into all these symptoms that I narrated in my presentation. And if you feel you have Parkinson's disease, you need to make an appointment with a neurologist, or you can come and see us at Hinduja Hospital and we will tell you whether you have Parkinson's disease and will recommend the correct treatment for you. Can other diseases resemble Parkinson's? Yes, there are many diseases which can resemble Parkinson's disease. And many psychiatric drugs or vomiting drugs, if given in excess, can induce Parkinsonian symptoms in many patients. How much cost does the treatment involve? It depends on what treatment. The medicines range from somewhere 200 to 300 per month to 1500 to 2000 per month. It depends on which medications we select and what medications you require. So according to the individual therapy, the cost is determined. What is levodopa? Now, levodopa is a synthetic dopamine that we give to the Parkinson's patient. It's an isomer of a dopa that is produced by our brains, and this was first introduced in 1960. Initially, we used to give it intravenously, and then we formulated it into the oral therapy, and it replaces the dopa deficiency in the Parkinsonian patient. What role do environmental factors play in the development of the Parkinson's? As I said, environmental factors are responsible. We all have done the epidemiological studies and we have shown that well water drinking, which may be contaminated with the use of pesticides or any toxins to the soil, may cause Parkinson's disease. Exposure to manganese, carbon monoxide, various toxins can give you Parkinson's-like features. So we know environmental factors do play a role, but not everyone who is exposed to the environmental factors get Parkinson's disease. So you have to have a genetic susceptibility to cause the damage to your brain with these environmental factors. So it's a combination of genetic and environmental factor which causes the Parkinson's disease. Any Ayurvedic treatment of Parkinson's disease? Yes, Parkinson's was in fact described in Ayurveda much before James Parkinson described it and made it known worldwide. It was known as Kampavata. And we all know that there were many Ayurvedic treatments available for Parkinson's, and one of the very successful treatment is a Zandopa, which is prepared by Zandu Pharmaceuticals. That's a Mucuna pruriens seeds which are crushed and given to the Parkinson's patient. They are identical to the levodopa that we synthetically prepare, and they have the same amount of side effects as levodopa. Genetic factors role, how to detect? There are many genes now associated with Parkinson's disease. So it is purely on the research basis that we are looking at it. We are looking at Parkin gene mutations, LRRK2 mutations, but we haven't found a definite causative factor or a definite genetic mutation that is seen very commonly in the Indian population. We are still finding out various genes, and we are still looking at various genes on the research purpose. But it doesn't make any difference to the treatment of the Parkinson's disease. How effective is levodopa? Yes, the Parkinson's patient are deficient in levodopa. So it definitely helps the Parkinson's symptoms. But that is usually in the initial few years it helps Parkinson's disease. Then we have to modulate the treatment because there is a receptor deficiency associated with it. So whatever dopa we give from outside sometimes may not work as effectively. What are the adverse effects if not detected in time? The common adverse effects of the levodopa when we start the treatment is gastric intolerance. That means you feel very nauseated, you get acidity, you feel like vomiting, and these are the common side effects. You may feel slightly dizzy. Once we start slowly and you can reach the desired level, then these side effects disappear. And usually the commercial preparations of levodopa have an additional compound called carbidopa, which prevents majority of these side effects. If you take levodopa continuously, your disease is gradually progressing. So there comes a time where levodopa may not be effective in controlling your treatment. This is the time when the fluctuations of the symptoms start. Levodopa doesn't last longer, and that's when we offer surgery to these patients. So levodopa has its limitations, but we are managing in spite of the limitations of the medications. What are gene therapies for? We still haven't got any conclusive gene therapies for Parkinson's disease. They are still in the experimental stages, and we still haven't come up with a very effective gene therapy in Parkinson's disease. How to manage cases of manganese mine workers of the body? Any neutralizing medications? No, we unfortunately saw these patients very late. The most important thing is to remove them from the toxic area, and that's what partially reverses. And some patients were given chelating agents to remove this manganese, but it didn't have significant impact on their recovery. Is there a genetic test available for Parkinson's? Yes, we do it purely on the research purpose. The genetic testings are commercially available, are very expensive, but we are doing it as a research purpose. The results will take a little while because they are dependent on the research grants. Is it hereditary? If your relative, close relative, that is your mother, father, brother, sister have Parkinson's, then there is a small increased chance that you may get Parkinson's as opposed to the general population who do not have any relative with the Parkinson's disease. But it's not prominent. With chelating agents, we have chelating agents like BAL, which is not available in India, it has to be imported. Then we have penicillamine, but these didn't work. US, there is awareness being created about Parkinson's, unlike India. We are beginning to start increasing the awareness of Parkinson's disease even in India. We have various support groups all over the Bombay run by Parkinson's Disease and Movement Disorder Society, which has also a website where you can log on. And we are slowly increasing the awareness of Parkinson's through these talks, through the media presentation. So definitely we are also heading towards increased awareness being created. It does occur in young age. We've seen patients who are as young as 15 to 20 years old, and we see it in children as well, but the causes of Parkinson's disease in children are different as compared to the adult. But yes, we have very young patients who have started showing the symptoms at the age of 20 to 25, particularly in India. Causes in children usually viral encephalitis, Japanese bee encephalitis, that's the commonest cause of Parkinson's disease. Metabolic disorders, Wilson's disease, Haller-Walden's disease, which is also now known as PICAN and NBI. So there are many causes of Parkinson's symptoms in the children. How to treat the children with PD? In the same way as we treat the adults, the dosage of the are considerably low. But yes, we treat the children with the same medications as adults. That is levodopa, dopamine agonist, anticholinergic. Is there any biochemical link of coffee and smoking with PD? Yes, we know there is a protective effect of coffee and smoking with PD. Smoking, that is nicotine, actually causes release of dopamine in the brain. We know that, but beyond that, we still haven't been able to isolate the exact biochemical mechanism of the protective effect of coffee and smoking. Coffee and smoking is protective towards PD. It doesn't cause PD. Link of exercises and treadmill in helping Parkinson's patient. It helps them maintain the balance, but one has to be a little careful about treadmill in Parkinson's. The patient has to be stabilized and the treadmill has to be monitored by the physiotherapist. The exercises that we recommend are mainly yoga and Tai Chi, as well as stretching exercises and balancing exercises. And exercises definitely help Parkinson's patient because it helps secrete the nerve growth factors in the brain, which are supposed to be protective. Yoga is very useful for PD. It's one of the ideal ways of exercising in PD.